How would you like to say goodbye to wrinkles and hello to plumper lips? And all it would take is a 30-minute treatment in a plastic surgeon's office like this one. An alternative to collagen, already in use in Canada and Europe, is about to get FDA approval for use here. But we've got the information and the results for you now.
What's inside this box is a hot commodity for many in the United States. Some call it the fountain of youth and are willing to travel to other countries for a shot at looking younger. It's called Restylane, and it's a face filler that is supposed to do what collagen does, but better.
Nice thing about Restylane, it's easy to use. It's easier to use than what collagen has. Collagen is a different material. It tends to be a little lumpy and not easy to inject. Nice thing about Restylane as well is that it has a potential to last a lot longer. It has a potential to last at least 6 months, even up to a year.
Restylane is made up of hyaluronic acid, which occurs naturally in the skin and declines as we age. It's injected wherever you want in the face area.
Since the injectable is composed of a substance in the body, no prior allergy skin test is required.
And Dr. Bart Rademaker believes that will mean less scarring issues that you might get with repeated injections of collagen. So, what does it look like once injected? Well, here are some before and after pictures supplied by the manufacturer. This woman had her frown lines treated. This patient had Restylane injected in the cheek creases.
I wanted it yesterday, so yeah, as soon as I'll be their guinea pig. But yeah, I'm real excited for it.
Some people are so crazy to get it, they're traveling to Canada, where it's already legal.
I have heard that there are situations where patients buy product here and then bring it back to the U.S. for treatment.
Dr. Rademaker, a plastic surgeon in Town and Country, got a sample from the manufacturer legally. He tried the product on a staff member to evaluate it himself.
But from a safety standpoint, I believe that Restylane is probably much better than collagen.
Here's Roxanne's lips before and immediately after. You be the judge.
The FDA has received clinical trial results with Restylane and may approve it for use here in the United States as early as this summer. We'll definitely keep you updated. In Town and Country, Linda Hurtado, ABC Action News.
Dr. Bart Rademaker is drawing a line between Tracy Posner's past and her future. It's a line she's been trying to cross for more than 30 years.
Ever since I was a child, I was overweight. I was always bigger than the other kids. I never felt I was good enough.
Tracy is part of a club of around 130 million Americans who are obese, unhealthy, and desperate to find a permanent fix. Included in that club, her husband, Brian.
I've been treated for high blood pressure for about 3 years.
I mean, I've lost like 100 pounds probably 6 or 7 times in my life, but always gained it right back.
And every time I saw the doctor, I would get the same warning. You're going to die if you don't fix this problem, and the way to fix this problem is to lose weight.
But many of the popular diets failed for them. They tried Weight Watchers, Atkins National Weight Loss, extreme exercising, and finally, gastric bypass surgery, a procedure where the stomach capacity is reduced to less than 3 ounces.
You have to take supplements the rest of your life. You have to exercise. It's not a magic pill.
But for the Posners, it did work. Together, they've lost over 300 pounds.
What's awesome about Tracy is that she is working out. If you look at her muscles, I mean, you've got really well-defined muscles.
But for Tracy, the weight loss wasn't enough.
It seems like it's more of an emotional issue for my wife than it is for me. I'm simply glad to be healthy.
I love you. All right.
Tracy wanted an extreme makeover, and that meant getting rid of excess skin.
And we're going to take out all of this.
Tucking her tummy and lifting her breasts, and that's where Dr. Bart Rademaker came in. He took off flaps of skin under her arms and removed the apron of skin around her belly. The results?
I think the most dramatic results for her are her arms, and they're definitely much improved.
Tracy will have her legs and breasts done in January, and then her extreme makeover will be complete. It's been a psychological as well as a physical transformation.
Since my surgery, I've just had so much self-confidence, and I just feel euphoric, actually.
When I look at my wife, I look into her soul. Like, the package doesn't matter. Now, it doesn't hurt that she's hot, but...
Paying for such an extreme makeover is a job within itself. The Posner's insurance company did pay for both gastric bypass surgeries, but did not cover any of the plastic surgeries. For more information on our story, log on to abcactionnews.com. Back to you. Here's something most women know. 90% of all pregnant women suffer from stretch marks, 90%. And people who lose a lot of weight quickly also suffer from these scars. Now, you could come to a plastic surgeon's office for a surgical remedy, but now there are new options that are much less invasive.
If our bodies were road maps that could describe how we've lived, then Christina's map would show she's paid a price for having been pregnant twice in her life. You can see her battle scars when you look at her stomach.
I've had 2 children, and am very self-conscious about my stomach.
Christina is like many women out there. She managed to take off the baby weight, but couldn't get rid of those stretch marks. So she turned to technology for help.
I've had 1 treatment, and I had good results. The stretch marks flattened out, and I lost some of the redness in the scar, and it was really good results, I thought, for 1 treatment.
This is a new laser that just came out on the market.
Carl Mudd is the CEO of Dermacare. He says women can come in for laser treatment right after they have their babies.
The more redness there is associated with the stretch mark, the better the laser will work in removing the redness. So it can be done almost immediately if there was not a surgery involved. What we were watching was the laser. The laser beam is going to stimulate the collagen in the stretch marks, which will cause them to fill out and be less noticeable. And more importantly, it will remove the redness that's associated with the stretch marks.
Unlike previous technology, that laser can work on almost every skin type, and so can this one, the N-Light system.
The way the N-Light actually will function is that it actually increases the amount of collagen and therefore the strength of the skin that you have.
How happy are women when they look down and they see some of those stretch marks disappearing?
They're very excited. Well, to tell you the truth, many people just hate those stretch marks, so anything that will just even minutely improve that stretch mark is such a wonderful thing.
So what price will you pay to get rid of, or at least lessen, those stretch marks? Here at the Artistic Center for Plastic Surgery, it'll cost you about $600 for the first treatment. In Town and Country, Linda Hurtado, ABC Action News.
You may be tall and skinny, or short and stocky, even rich and famous. Cellulite does not discriminate, as the harsh eye of the paparazzi camera shows.
First thing that we do is we check your temperature.
But employees at a local Medi-Spa here in Tampa swear they have found the answer. It's a new machine that uses radio frequency energy to reduce bumps and bulges and generate more collagen to keep you looking younger.
It's kind of cold, right?
Yep.
All right, so it's going to heat up after a little bit.
60-year-old Maria Kukalovis isn't so worried about cellulite, but she does want to tighten the skin on her face. She wants a refreshed look for her son's wedding.
The marks around my jowls and on my forehead, and the little pockets that I have under my eyes.
Why this treatment? Just approved by the FDA?
Well, because it's non-invasive as far as, being cut and being, having to go through surgery. There's no downtime.
Dr. Bart Rademaker uses the Accent Machine's radio frequency technology to heat up areas of the inner layer of her skin. As the dermis is heated, he says a natural reaction is supposed to occur, promoting the formation of new collagen.
And the heat process is what really creates all the changes. You have increased circulation, you have increased production of collagen, and what's also very, very exciting is that it also tightens the connective tissue.
Dr. Rademaker says there are virtually no side effects.
You'd have to put this device, the handpiece, on a skin area, hold it there for 1 entire minute before you get a burn.
And the wand, or gun, is constantly moving.
It's very relaxing. It was like getting a massage with a warm wand.
Were you happy with the results?
Absolutely. We were told, you know, we weren't going to see any results for 3 weeks, but I could see results right away.
The accent requires 1 to 6 treatments, and they cost about $375 each. While they are long-lasting, they're not permanent. Here are some before and after pictures provided by the company that makes the accent machine. Because it's supposed to take a while for the collagen to rebuild and for the client to see results, we'll check back in on Maria in about 2 weeks. Linda Hurtado, ABC Action News.
Some would argue a woman's breasts define who she is. And for the women shown in these pictures, it was a very unpleasant image.
Scars are perfect. They're awesome.
Dr. Bart Rademaker is a leading plastic surgeon in breast augmentations and implants, performing around 30 breast surgeries a month.
As we age, what happens is that the breast tissue kind of stretches out, the skin kind of stretches out, whether you have implants or not. For a woman, that's not, very pleasing to have, a breast that's hanging and a nipple that's hanging.
Dr. Rademaker is helping more and more patients like Marie Jones, who was unhappy with breast implants she received from another doctor. This is her before photo.
I was way too big for me, and I felt uncomfortable in my own skin.
6 weeks ago, Dr. Rademaker performed a reduction and lift on Jones, who is now very happy with her new look.
I was actually almost an E. I am now a C.
Dr. Rademaker says a lot of his patients, like Alex Stocks, want larger breasts, but are fearful of scarring. This is Stocks before surgery, a B cup. This is her today, a double D with no scars.
I make a very small incision about that size through the armpit in one of the creases. So, in fact, in most of my patients, you can't even see that incision.
They have completely changed me and my confidence, and I have no negatives about it.
And now to one of Dr. Rademaker's most challenging makeovers. This mother of 3, including twins, asked we not show her face, but agreed to share this before photo of her natural breasts, which were deformed and caused her a lot of grief as a teenager and woman. This is her just 10 days after breast reconstruction, with no implants. The FDA has now approved silicone breast implants for all women, and Dr. Rademaker says they're a great solution for women with less breast tissue. A breast augmentation will cost anywhere from $5,000 to $8,000. In Tampa, Susan Casper, ABC Action News. Melissa Klass hurries to see her plastic surgeon while on her 1-hour lunch break. This busy mom is a fitness instructor who wants to shape her body into a perfect 10 without the scalpel.
No matter how many crunches or what diet or how many runs or triathlons, it's not happening. So I need a little help.
So after the birth of her second child, Melissa decided to do something about what she calls her mommy pooch.
This little bulge that's right here is where I'm centering my attention on.
Melissa has tried other procedures to erase her belly fat, including liposuction, but didn't get the results she wanted. Now she's hoping anti-fat injections called LipoDissolve will melt her fat away.
I want to hear, wow, you look fantastic without for having 2 kids.
Those fat cells will slowly dissolve.
Leading plastic surgeon Dr. Bart Rademaker is performing Melissa's so-called lunchtime lipo. He begins by marking Melissa's pockets of fat. Then he starts a series of 10 to 20 injections of a concoction containing natural chemicals found in the body.
I put in anywhere between half a cc to a cc of the material right into the middle of the fatty tissue, staying away from the muscle.
LipoDissolve can be used to remove body fat from the belly, to double chins, to love handles. It is permanent unless you start to gain weight. And doctors say expect a few days of side effects, including swelling and aching.
What I'm going to want you to do is I'm going to want you to massage it 2-3 times a day.
Melissa said the procedure was virtually painless, and she can't wait to see the results.
Very exciting. And I really did not even feel it.
You won't start seeing results with LipoDissolve for 6 to 8 weeks. Dr. Rademaker urges you to go to a board-certified plastic surgeon who specializes in liposuction. The cost of one treatment is about $650. In Tampa, Susan Casper, ABC Action News.